Excited to be with you to talk more about Cochrane Clinical Answers. This is something that I've been working with since 2012, and I've been fortunate enough to be in the position of editor-in-chief for Cochrane Clinical Answers since 2019. Today, we're going to spend some time talking about what Cochrane Clinical Answers are, why you should use them or consider using them, how we select and create them, how you can find them so that you know where to look. Also, how to navigate once you do find them and use them in your clinical practice. And then lastly, want to just make sure everybody knows how you can get involved, or you can let somebody else know who you work with or interact with clinically, potentially who might be interested in getting involved with Cochrane Clinical Answers. So diving right into it, what is a Cochrane Clinical Answer? So the biggest thing to know is that these are written by and really are for, or intended audience is clinicians. Cochrane and Wiley have a unique partnership in this, and each Cochrane Clinical Answer is really just trying to get a brief evidence-based answer for clinical questions that are based on these large Cochrane reviews. They're structured in the traditional or most classic evidence-based medicine format, which is a PICO question. That's patient, intervention, comparison, and outcome. And that is based on the PICO from the actual Cochrane review. We intentionally design these to support point-of-care decision-making. We recognize that the overall Cochrane review is pretty unwieldy when it comes to being able to quickly look at it and digest it and make a reasonably quick clinical decision. And so the idea with Cochrane Clinical Answers is, can we get some questions that are going to be common, that are going to be frequently asked based on this review, but will give us good outcome evidence, or at least evidence that we have to answer the questions. Also, just so you know, these are included in a Cochrane Library subscription. So everyone who already has access to CochraneLibrary.com is going to have access to all of our Cochrane Clinical Answers. It says greater than 3,600 Cochrane Clinical Answers. I think as of this morning, we were up around 3,700, but we are kind of consistently putting these out. And so lots and lots of answers are available for your review and use. So why do you want to use it? Well, I already talked about a couple ideas, but as you know, Cochrane sets itself as a home for evidence, trying to always make decisions, whether it's clinical decisions, whether it's clinical adjacent decisions, that are based and grounded in evidence. And all of our answers are from or based on Cochrane's rigorous systematic reviews and meta-analyses. These are clinically focused answers. So while many of the Cochrane reviews provide background or information that you can utilize clinically, we take it to the next level with Cochrane Clinical Answers, where we are asking questions that are always going to be clinically focused. That means practicing clinicians have the most relevant clinical evidence to be able to use and make their decisions. Again, the goal for us when we create these is to make them be time-saving, practical, and we essentially turn a long review into a concise summary. The other big key of Cochrane Clinical Answers, when you actually look at our product, which we're going to do some screenshots, you're going to get a chance to see some of the actual products. They're ideally set up to be easy to use. We provide information if you want it. So tables that are user-friendly, data, graphics. But if you're like, that's nice, Chris, I see the little thing, but can I see the review again? I want to compare something. Yes, you have access with one click to be able to get back to the full review and toggle back and forth. One of the questions that we get asked is, hey, are people interested in this? What have you demonstrated so far? And so we actually did a UK YouGov survey where we really reached out to about 1,000 members of the NHS staff. This was back last March. And what we demonstrated, or what we found, is that there was really good or strong support for CCAs among all these healthcare professionals in the UK. And that included all the folks you can see listed on the slide. But over 3/4 of them all said they would recommend CCAs to a colleague. And if, in case you're wondering, for other kind of point of care tools, this is not getting into AI at this point, but this is more just kind of point of care tools that people could utilize where they can quickly access information. That it's comparable to that, which is great from our perspective to see that. Another question that we often get asked about CCAs, and this is addressed in our About CCAs Frequently Asked Questions page on the Cochrane Library, of course, is how do we choose the reviews that ultimately then become CCAs? So there's a rigorous criteria. We have it all laid out as kind of part of our process. But first, we look at relevance. Does the review even offer us the opportunity to tackle an important clinical question in everyday practice? By nature, that means that things that are more common, that we are seeing more commonly in the clinical space, or whether it's ambulatory, meaning outpatient centers, or whether it's in hospital or inpatient, we want to reach as wide a healthcare audience as possible. And so we were going to select things that are more relevant, and that means more common. We also think about it being up to date. We want studies to be recent. Ideally, we'd like them to be within the last 3 years. That is not always possible. Sometimes the best evidence we have is from studies that are older. Even when we try to do an update of a review within the Cochrane world, sometimes there's just no new evidence that's come out. It still may be the most relevant, up-to-date information we have, but we do, whenever possible, try to seek out up-to-date info. The other thing we have is we have kind of this volume or up-to-date kind of volume of evidence. And the issue there is we're trying to draw significant conclusions. We're trying to have sufficient data to be able to draw conclusions. However, we also may want to be able to highlight an important evidence gap. All the time, we realize that we don't have enough information. There's nothing we can really do about that. The other thing that if you spend any time at the Cochrane Library, you notice that there are things that are called priority reviews. They may be referred to sometimes as high profile reviews, but basically these are reviews that are going to be informing the world with kind of controversial potentially topics or topics that are very relevant. Obviously, during the pandemic or as the pandemic was beginning to wane, we saw lots and lots of high priority reviews that were associated with COVID-19. I want to assure you, because we do get asked about this too, any potentially controversial topics, any potential high priority, high profile reviews, we treat them the same as all others. The only difference is that they probably would get included in our process. However, our CCAs still are going to clearly describe the evidence and its certainty, regardless of whether that meets somebody's political whims or not. We are just going to lay it out and say, here's what we found and here's what it shows. So when I say we, who is it that's creating CCAs and how do we do that? You already met Selena and Kat. Sophia is the other member of our core leadership editorial team. And we essentially work with them as professional editors, as well as our associate editors and our clinical advisors, who are healthcare professionals like myself. Basically, we select the most patient-oriented comparisons and outcomes. Remember, when we're talking about that, the idea of disease-oriented versus patient-oriented for outcomes is very important, and it's an important distinction that I want to just foot stomp or emphasize. An example of a disease-oriented evidence would be what someone's blood pressure is. We know, or we believe we know, that when we lower blood pressure, still following a disease-oriented evidence, we reduce the risk of heart attack and stroke, for instance, over time. However, it may not work for all people, and the reason is because there's other risk factors that are impacting that risk for heart attack and stroke. One of them happens to be blood pressure and whether it's elevated. What we sometimes look at, or what we should be looking at more commonly, even in that example, would be, are we reducing heart attacks? Are we reducing strokes? Things that directly impact somebody's quality of life, their mortality, their hospitalization, their morbidity, etc. So whenever possible, we are trying to make sure we are selecting patient-oriented comparisons and outcomes. And just so you know, every single CCA involves, in the writing stage, at least one practicing clinician, and everyone undergoes multiple checks for both accuracy, of course, the standard editorial checks, and as well as clinical relevance. And every single one is signed off by me as the editor-in-chief. How do you search for CCAs? Let's talk about that briefly. This is going to get into a little bit of some screenshot action for you. Again, as questions come up, if they do, please just enter the questions into the chat, and we'll make sure that we get to them kind of near the end of the talk when we'll have plenty of time for Q&A. All right, so if you have not visited the recently updated CochraneLibrary.com, I would encourage you to go. You may know that there's now kind of an intermediate screen from some countries where it's asking you to prove that you are a human. It sometimes just adds a little bit of a delay. Sometimes it's a lot of delay for some countries, so we are acknowledging that. Once you've reached the CochraneLibrary.com homepage, this is roughly what you should see. The screenshot that I have here is demonstrating how you would navigate directly to Clinical Answers. So right along that top toolbar, Clinical Answers is the third from the left, third from the right, however you want to look at that. When you click on it, you can see that there's a multitude of options that you can do. The simplest one is Browse Clinical Answers, which I'm going to show you on the next screen. I already alerted you before, excuse me, already alerted you before about some of our frequently asked questions, which is on that lowest down area where it's talking about and how to get involved. But you can get to that same screen by just clicking on the Clinical Answers homepage, which we have revamped, tried to make it cleaner and more up to date. And then you can select things as the most read clinical answers, where we're trying to put down the most read, and that's updated monthly. You can have ones that are chosen by me as the editor-in-chief. That usually dovetails, and we'll talk about this in a few slides, that dovetails with some of the overall Cochrane scientific strategy. We talk about how we select CCAs. We talk about how we develop, in case you haven't had a chance to sit through this webinar. And you can, of course, meet the team and learn about how to get involved. So, browsing clinical answers. This is what happens when you click on that clinical answers and then click on browse. This slide was from last week. As I mentioned, we're already kind of further along with where we are, closing in on 3,700. But what you can see is that this just comes up to the first thing that is noted, and it's just kind of all text up in the top right. You can see when you're browsing that it shows you all the clinical answers that are there, and they're organized in various ways. Usually the default is that it's organized for newest to oldest in the published date. And so you can see that in the center of your screen by order by. There are, of course, drop-down menus next to that order by. You can do it all sorts of different ways to your heart's content. Some other options you can do is filter them, right? So we'll talk about how you can order it. Right now, as we noted on that previous slide, it's published date, new to old, but you want to look up the title alphabetically, reverse alphabetically. You can do relevancy. And then, of course, we can do the opposite of what we have now. We do to old. We can switch it to old to new. That allows you also to kind of do some filtering. Some of the filtering you can do, one of the examples is by topic. I believe we have 37 different topics that you can select from. This allows you, if you're like, I'm interested in reading a little bit more about complementary alternative medicine, I want to see what CCAs have been done by that, I could select that. You can see that there are 264 CCAs that have been completed for the CAM, and you'd be able to read through those and look at those. You can also, of course, as Cochrane Library has done forever, search by keywords. Up in the top right, you'll see that there's an option with a drop-down. Many of you may be familiar with this if you spent any time with Cochrane Library, where title, abstract, keyword is one of the headings. And in this case, we typed in obesity just to see how many had it actually as a keyword in the Cochrane Clinical Answer question. That does not mean that this is comprehensive. One of the limits, I'm just going to be straight up with you and honest, is like one of the limits with the Cochrane Library is that sometimes you type in something, those keywords are usually only in the title. That's the title of the review. That's the title of the clinical answer, special collection, etc. But you may have lots of information about obesity, for instance, that could be found within multiple other Cochrane reviews and multiple other clinical answers. So not all inclusive, but this is a good way to get started when you know that it might be addressing something with that. The other thing to know is that when we create our titles for the Cochrane Clinical Answers, they are usually very closely linked to the title from the actual Cochrane review. So just so you're aware when you're looking at a Cochrane review, like I wonder if there's a Cochrane Clinical Answer. Well, if you're in the Cochrane Library, you can quickly look on the side and find it. So this is getting into how you navigate from the Cochrane review to a CCA. Example here, intermittent fasting for adults with overweight or obesity. Relatively recent, this is a February 2026 Cochrane review that was published. This is the main screen when you're looking at this. This is not the PDF. This is how you can navigate. On the right side, you have your navigation bar. That allows you to jump quickly between pieces or components of the Cochrane review. For our world, so when we're talking about related things, Cochrane Clinical Answers are considered related to the Cochrane review. Just like if you're in a Cochrane Clinical Answer, you're actually able to jump back to the related Cochrane review. So you're reviewing through your Cochrane review, and on the right side, as you can see, kind of circled in red, there's related. one Cochrane Clinical Answer with this review. I will note that we have sometimes reviews that, because of their size, because of the number of clinical questions, the number of PICO comparisons and outcomes that they're examining, we actually can have multiple clinical answers, sometimes upwards to 3 to 5 clinical answers for a specific review. And you'd be able to access all of them on this right side of the toolbar to quickly toggle back and forth to your heart's content. Let's talk about that when we're talking about how to utilize the CCA. And this is near and dear to my heart as a practicing clinician. I want to think about, okay, get to the bottom of this. How can you just tell me, how do I really utilize this? So a couple things to know. So this is an example of one of our Cochrane Clinical Answers. This is really getting into the idea of prophylactic antibiotics during labor. This is for females with a planned vaginal birth. And we're thinking, is there a benefit or are there risks for a one-time dose of prophylactic antibiotics? That means antibiotics just given automatically during labor. And the goal, and then the outcomes that are looked at. So remember, every question has that PICO format. The outcomes that are looked at are maternal and neonatal infection and mortality. So we're really looking at patient-oriented outcomes. If someone gets an infection, do we care about that as a patient? Yes, of course we do. If someone dies, we care about that. Yes, and their family cares about it too. So those are important patient-oriented outcomes. When we look at this Cochrane Clinical Answer, this is the format that you'll see whenever you're on just the main web landing page for a Cochrane Clinical Answer. At the top, you know you're in Cochrane Clinical Answers because it says Cochrane Clinical Answers. You have your question. Then you have the author. That is going to be the person who is the practicing clinician that wrote the Cochrane Clinical Answer, the date that it was published. We then have the original DOI associated with this Cochrane Clinical Answer. That allows you to link to it in case you want to jump back and forth to something else. Below that, we have the actual answer. Most of the time, we are trying to get these certainly under 500 words, ideally under 250 words. If these are longer Cochrane Clinical Answers, we usually will have a bolded bottom line that is a kind of first or second paragraph, the first 1 to 2 paragraphs, I should say, that allows you to quickly get an answer that way. If you go down below the clinical answer, you will then see the clinical interpretation. I'm going to talk a little bit more about those. The clinical interpretations are written by the practicing clinician with the mindset of the practicing clinician. So not only are we writing the clinical answer up above, which is trying to kind of concisely summarize the outcomes that are important to our patients, but the clinical interpretation is trying to give you a very specific, logical, kind of common sense approach to whether this matters. So when you look at that, it's saying a one-time dose of antibiotics during labor appears to lower maternal risk, sepsis, and infection. Benefits are modest, but may be cost-saving. That's something obviously that matters for patients, what they may or may not have to pay, and meaningful at a population level. What that's getting at for folks who are trying to think about narrative statistics is that this matters most when we're trying to do this over the large group. However, you think about a higher risk setting, an area where we know based on data that there are more people that when they're in labor develop infections, either in labor or shortly after, or when there's higher neonatal or infant mortality, we want to make sure that we're potentially treating folks in those settings. They then comment in this clinical interpretation of how in lower risk settings, where the neonatal mortality is not as high, where there's not as many infections that come about in the immediate postpartum period, clinicians will need to just weigh those modest benefits against concerns that are very valid. Usually, most commonly when we give antibiotics, we're worried about antimicrobial resistance. Basically just local context, each woman's infection risk, those are the things. So it's trying to take it and put it into a common sense approach where you can think about it logically, and you can also try to make a more informed clinical decision based on your patient that's in front of you and your patient population that you're taking care of. On the right side, a couple of key things to highlight. One is that you like looking at things in a PDF. You want to share this information in a PDF format. Well, you can now download PDFs for all of our Cochrane Clinical Answers. Most of them come across as 2 to 3, maybe 4-page PDFs, so not that large. But the first page is always the meat of the CCA. It has the question, it has all the information you see on the screen on my left column, readily available with resources listed for the first page of the PDF. So if that's all you want to share, that's what you want to quickly look at, you're ready to go. Below that, or next to the share option, below download PDF, we have cite this answer. So for those of you who are saying, hey, I would like to be able to use this in a presentation, I want to make sure that when I'm talking with learners as a teacher, I'm sharing kind of where I got my information. That quickly will allow you to cite the answer, and you can copy and paste the citation and do that. Below that information, of course, you can sign up for email alerts for the topic. So if this is something that's near and dear to you, with it, whether it's research, clinical, practice, et cetera, you can sign up and you will get email alerts when there are new things written on this topic of any kind from the Cochrane Library. Further below that, we've got the number of full text views that has happened so far up to date. Below that, again, remember I mentioned that you can get related information and can kind of jump back and forth. We have the information for the actual Cochrane review, when it was published and what it looks like. So if you were like, I want to go look at this Cochrane review, I really want to see something more, I could do that. Further on down in that toolbar, you can jump between sections. On this one, because the answer is not that big, you can already see the clinical interpretation on your screen, but in case the clinical answer was larger, you would be able to jump down and see the clinical interpretation. And then we get into the more specific data where I was mentioning about kind of the user-friendly tables and information, and I wanted to highlight that for you. So here's the overall thing again. Here's the specific clinical interpretation, which we talked about, and then we get into comparisons. So as you can see, there's actually an opportunity for you to expand things here. These were all of the outcomes that were considered and considered as reasonable, clinically focused outcomes by the practicing clinician that helped write the CCA, or that wrote the CCA in this case. In the top right, you could expand all of these. If you're saying, hey, I really don't want to expand all, I just want to look at one, well, you can also do that. So you can see antibiotics versus placebo. That was the initial comparison that was studied. And you can look at outcome 1.1, and this is maternal sepsis. And the way they kind of commented on that or kind of qualified that was within 28 to 56 days postpartum, they were looking at the rates of maternal sepsis. And as you can see on the screen, there's both a narrative result, so some quick sentences where they give more specifics about what the outcome was. They talk about the certainty of evidence. If you recall, Cochrane always tries to use the grade scale when they're scoring and updating evidence certainty. And if they cannot use grade, because they will state the reasons or limitations why they could not assess grade, and they will talk about the risk of bias if they're not able to talk about grade. They then get into the idea of what the relative effect is or the mean difference, and then they show you the actual data from the Cochrane review. They then talk about an absolute effect, and that's where we try to break almost everything down whenever we can do this into the number per 1,000, and obviously have a 95% confidence interval for that as well. And then there's usually a reference, and the reference in most cases when you were talking about this comparison is going to be the original Cochrane review, because that's where we have the layout of all the other studies that went into that review, into that meta-analysis, as you can see listed by both the principal investigator and date of when it was published. Again, after you've gone through all of those outcomes, you can see on the screenshot that I have here, we have outcome 1.13. So that means there were 13 different outcomes that we were considering clinically relevant during this creation of the CCA. Once you've gone through all of those, we have the overall population intervention and comparator that was utilized. We already talked about how it was antibiotics versus placebo, and that is listed in the intervention and comparator. However, you wanted more information about the population. You didn't want to try to find all the stuff that was written out in the Cochrane review. Here's a place that you can go to get that information. So you can see that that's listed here. The other thing that's below this usually, so once we've scrolled down a little bit more, it actually, on each CCA, we have information that are the PICOs. Remember I talked about that as the population or patient group, intervention, comparison, and outcome. You can see that in bold across the middle of the screen here. You can see the number that were considered, and they're from the original review. So if you went back to the original review, you would also be able to find this PICO as stated. A little bit more information just about PICOs and what that means, of course. And then down below, we have additional information. This helps you with all the different things that we already noted from above, where it gives you a little bit more information about the associate editor, way that you can contact the CCA team that goes directly to our team in case you have questions, comments, concerns about the CCA, or just any interest in getting involved as well. And then you can also review the declaration of interest. This is often called a conflict of interest or declaration of interest, but this allows you to quickly see what Dr. Nabhan potential declarations of interest were, and you would then feel a little bit more comfortable about anything that has been written by each of our associate editors or clinical advisors. I highlighted this already, but just kind of remind you about that. This is going to be just a quick way that you can kind of update things. One thing that I did not comment on that I wanted to mention, down at the bottom of this toolbar, if you wanted to request permissions, this will be something where you're wanting to utilize this outside of where you would just be citing it. And so you are, of course, welcome and able to request permissions to utilize it from that standpoint. The other thing that I neglected to mention earlier when we were talking about the citing the answer or how to cite the answer is that you can export this citation. So that sometimes can be really useful if you are already working on some research paper, you already have a specific citation manager. Maybe that's RefWorks, maybe it's SciWheel, maybe it's, as you can see, other things like EndNote, Reference Manager, etc. Well, you can do any approach that you want, whether you want to just take the thing that's up top and copy that as a simple format, whether you want to use a plain text, etc. You can download in the format that you choose and allows you to kind of interface with your own citation management system. All right, so we talked about some of these things already, so I'm not going to spend a lot of time talking about that more. Let's just think about how to use CCAs in clinical practice. We already touched on these kind of components, but just know that we are always trying to think about it being a brief evidence-based answer to a clinical question. And ideally, me as a provider, as a practicing clinician, I'm going to come to this information. I'm going to make sure that I'm trying to quickly answer a question. And so if I do that by keywords, if I do that by typing in the phrases that are, the patient that I'm interacting with or the patient I could be interacting with in the near future, the population I'm taking care of, what's new about my population, I'd be able to kind of quickly access CCAs and answer my questions as quickly as possible, assuming that they're available. The other thing that Cochrane Clinical Answers has done, and one of the ways that we are now emphasizing utilizing CCAs, is we're trying to help bring it into your, as a practicing clinician, everyday workflow. We know that more and more providers around the world are using electronic medical records. We know that more and more of them are using AI that is embedded within their electronic medical record, or they're using AI to help with crafting notes that may be separate from electronic medical record. Actually, their AI may be their electronic medical record. And we want to make sure that we're constantly looking at opportunities to get CCA information out there. Those have turned into partnerships that we have now with CCAs. Some of those partnerships are even above us. They're Cochrane Library partnerships. Some of them are emphasizing CCAs, however. Some key ones that you may have heard of or that you may be aware of include Microsoft Dragon Copilot, one of the AI tools that the Microsoft family works with. You also may have heard of Open Evidence. That's another AI point of care tool that also has partnership with Cochrane Library. So now when you're searching on either of those, it will bring up Cochrane reviews. It will bring up Cochrane Clinical Answers to help you when you're trying to answer your questions utilizing AI. I did note that there was a update about Open Evidence in the UK. So our UK colleagues are not able to directly access Open Evidence, and that was because of essentially regulatory and financial concerns on Open Evidence's part. They decided not to go through things when there was pending, let's say, legal issues where they were kind of adjusting what the regulations were going to be. So that is a TBD, to be determined, kind of next steps for the folks in the UK, unfortunately. The other thing that you should know is that many of these kind of well-used or useful clinical resources that are out there, so like British Medical Journal has their best practice site, Ovid, EBSCO, they all offer opportunities where CCAs are already incorporated. So if you're searching on those, you may not have known this, but you're getting Cochrane Clinical Answers as part of your outcomes and results. The big thing for you is that if you also have a Cochrane Library subscription, you can quickly just be like, oh, that's Cochrane Clinical Answer. I know how to access that, and I can get that better in a better format than I have to do through BMJ Best Practice, et cetera. and you can quickly jump back to the Cochrane library, which hopefully you have bookmarked to be able to use. All right, let's talk about some recent updates to Cochrane Clinical Answers. In case you were worrying about it, Selena and Kat and Sophia and I are always working on trying to make our product better. We know that it can be better, so we welcome your feedback, would welcome you to provide comments about how we could continue to make it better. So some things we did recently, some things we have done in the recent past. So I already mentioned that clinical interpretations was a major overhaul that we added. And the biggest thing that I would take away from this is that they've been very well received. Everyone's very happy with these, and really can help our clinician colleagues as they're trying to make medical decisions. Of course, providing the overall disclaimer, it's really just for information only. You want to think about your individual patient. You want to think about your patient population. You know them best. And so you want to make sure you're making best informed decisions with that. I already mentioned that we have downloadable PDFs. I'm going to show a couple of those on the next slide so you can see that. You'll be able to read that offline, access on the go, makes it a lot easier when you're sharing it with learners as well. The other thing I mentioned already that we've revamped the homepage for us on the Cochrane Library. That was part of a bigger revamp for all the Cochrane Library. Basically, again, trying to make things more useful and more usable for our clinicians. And then recently we've added the chosen by the editor collection. Those are things that I have worked on with the editorial team to make sure that we are keeping things current. So it's regularly updated, it's curated, and also emphasizes our top 10 most viewed CCAs per month. So here's an update. What one of our recent updates, the adding PDFs looks like. So this same CCA that you had seen, in this case, we have everything on that one first page of the PDF. You can see that the PDF extends for other pages. That was because we had 13 outcomes for that one. And so when you get into more pages, obviously we're getting into the specific outcomes in a 2-column format. But you can see that you would see as much or as little as you wanted based on that. And all you would really need, if you were just like, I just need the answer, I want the clinical interpretation, I want the how to reference it, you would get that on the first page of the PDF for every one of our Cochrane Clinical Answers. Another thing was the website revamp. I already showed you a couple ideas from this, but I did want to highlight when we're on Clinical Answers, you go to the Cochrane Clinical Answers home, we're going to get into the opportunity to learn more about a Cochrane Clinical Answers. This is kind of like the six jumping off point splash page. You could do about clinical answers. You could explore them, which takes you back to the opportunity for you to kind of do your own browsing. You can meet us as part of the team, discover how you get from a Cochrane Review CCA, look at our most accessed, and this is going to be the last month's 10 most accessed CCAs, and then we have our chosen by the editor piece. So most accessed, we're currently showing April since we're in May, and you can kind of see what has been most accessed. There are 7 on this screen, but we usually will have 10 because if you scroll down, you'll be able to see the others. We also have the chosen by the editor. I mentioned previously, Cochrane has a scientific strategy for the 2025 to 2030. These are key priority areas that Cochrane is focusing on. We kind of matched up or dovetailed our choices associated with this. So each one of these areas, if you're interested in reading more about, for instance, maternal, newborn, and child health, you'd be able to select that where it says read more, and then you could go to and see kind of what this looks like. So here's chosen by the editor in the maternal, newborn, and child health area. And you'd be able to kind of quickly look at the most recent that are published and go through these. Most commonly with these chosen by the editor, we try to make sure that the top 3 in each category are freely available. So if you don't have a subscription to the Cochrane Library, you'd still be able to access usually the top 3 listed in each of the chosen by the editor. And that's meant as both a way for people to see things that are considered high priority or high profile, but also a way for us to allow someone to explore a little bit of Cochrane Clinical Answers, even if they may not have a subscription. We also talk about the high priority, where these are going to have the top 3 that are also out there and available. All right, I promised to talk about how to get involved, and then we'll get into some questions and answers. So we welcome practicing clinicians. We welcome healthcare professionals with strong clinical experience, because as you saw, each of these Cochrane Clinical Answers has to be written by somebody that has that clinical experience. We need someone who is ongoing clinical care, is able to understand and provide a clinical interpretation that all of our colleagues around the world are going to be able to use. remember, in that role as an associate editor, in that role as a clinical advisor, you're going to write these Cochrane clinical answers based on the Cochrane reviews. It's going to be within your area of expertise. We're not going to ask you to do something that is beyond where you feel comfortable, but you're going to be able to shape concise, actionable content to really support point of care decision making for your colleagues. If that sounds like something that's interesting to you, please send a brief CV. Make sure you're highlighting your clinical experience to our email address, which you can see there, clinicalanswers@cochrane.org. Again, we welcome feedback about Cochrane Clinical Answers. We want to make this product better. We are working every day to make it better. We are all passionate about these Cochrane Clinical Answers. We feel they are vital to providing care for reaching people, especially in under-resourced areas in the middle income, lower income countries where we know that the resources are not there and you may have only access to be able to seek out Cochrane Library. We want to make sure that you're thinking about adding this to your bookmarks, you're getting in touch with us, and I'm going to pause there and stand ready to answer questions. Thank you.
Thank you so much, Chris. Hi, I'm Kat, one of our editing team, and I'm here to field your questions. So we do have a question in the chat for you, Chris, which is, on the Cochrane Clinical Answer webpage, can we combine PCOs like age and, say, TIPS as the intervention? I felt it was difficult to find answers using P and I combinations, but in clinical settings, we're also encountering questions like, what are the benefits and harms for a patient living with liver cirrhosis over 65 years old who's being treated for TIPS? Drug treatment versus endoscopic treatment in this setting. What are your thoughts on that?
Thanks, Kat, for moderating, and thank you for the question. This is an awesome clinical question, near and dear to my heart. I have many patients who are dealing with liver failure and stage liver disease for various reasons, and so often we'll see something like this as well. So one of the big things to understand when we're talking about Cochrane Clinical Answers is that we, when we're writing these, we are limited by what has been done within the actual Cochrane review that we're utilizing that information from to craft the Cochrane Clinical Answer. So if there is a Cochrane review that has addressed those things with PICOs in that fashion, then yes, we're going to be able to answer the question exactly the way you talked about, where we'll be able to talk about a patient who has end-stage liver disease or has already undergone a TIPS procedure, and we'd be able to kind of combine that, right? So that patient, we'd be able to talk about is they're over 60, they're over 30, they're over 40, whatever that age is, we'd be able to do that. If the review has not combined that, if we don't have enough information about that to even craft a review, then no, we're still limited by what the actual Cochrane review has. So a couple things for you to think about there. So one, you can look and see under keywords, and you search under TIPS. You can look under end-stage liver disease. You can look under liver failure. You can look under cirrhosis, like keywords that would be maybe more applicable for you, your patient, the patient population. And then you can see what reviews have been done. You can actually see what Cochrane Clinical Answers have been released so far. And that would allow you to quickly know whether you'd be able to answer your question exactly the way you wanted to.
Great. Thank you, Chris. I hope that helped. Just an extra kind of add-on for me to help with that. At the bottom of our CCAs, we mentioned, but we've got the PICOs from the original reviews. So when you are looking at really specific populations, scroll down, have a look. They come from the original review. They'll give you a clear idea quite quickly if your population will be in there. And with CCAs where we base our evidence off of the review, we can narrow it down. But like Chris said, we are limited to what is in the review. And
thanks, Kat. That's great.
Great. Right. We have no more questions in the chat at the moment, but we do have time. Please put them in there. Thank you, Selena. So Selena's just mentioned that you can use the advanced search to build out a search. That way, you can combine different elements of PICO in your search. That might help tailor your results. That's a really great tip. Thank you.
Yeah, thanks, Selena. That would be a way that you're looking at the overall Cochrane library as well, and that would then tell you whether we have CCAs that are answering those questions or whether you're limited only to the review or reviews that have come out.
Great. Chris, I had a question. I thought it might be maybe useful. Would you be able to share a bit about some of the feedback that we might have had from users of CCAs? We've obviously mentioned that clinical interpretations have gone down. But yeah, could you share how the kind of feedback we might have got and how we as the internal team, we use that to develop the product?
Yeah, thanks for that question, Kat. So it's been been working with CCAs for quite some time, and in the editor in chief role for 7+ years, and so we've gotten lots of feedback over long periods of time. I will say that one of our goals on getting better was related to some of the feedback that we've received, and one of those areas is that people have said, "Hey, can we make sure that the CCAs are being released closer to when a Cochrane review is being officially published?" Which is our goal, is to get to where when the Cochrane review is published, so like let's say it's published today, that we also are releasing CCAs that have been written associated with that Cochrane review at the same time. We've gotten closer and closer to that. There's a lot of logistical hurdles, as we've discovered, but that's an example of where we've received feedback that people are hoping to have that. And it makes sense. If I'm a clinician and I see that a Cochrane review has been released and I'm like, oh, I got some questions, I need to be able to quickly answer this. This is great. And then there's no Cochrane Clinical Answers yet available. I'm pushing to try to get that to come out. And so that's an area that we are trying to actively work on, is getting that closer and closer and closer to when those will be released. And then other feedback that we've received prior to starting the clinical interpretations was generally people asking questions about, like, okay, this is great, but what do I do with my patient? And so that was part of the reason why we began the discussion around clinical interpretations, got approval to move forward with that with the editorial board, and have had just an amazing response from people about that. The other areas that we get feedback about include similar questions to what we were just asked about, the kind of liver disease tips, etc. And that's where, just like me, when I'm in clinical practice, I'm constantly asking questions, and I really just hope that Cochrane has answers for me. And sometimes Cochrane just doesn't, because we have not done reviews on that topic area. There's not a more recent review in that topic area, or there's really an evidence gap. And we know that we're limited to that when we're working on our CCAs as well. But that's additional feedback that we've gotten, where people are like, "Hey, we would love that if we could get this to be more interactive or other things." We're constantly working on how we can do that, and that's why we've added things like the PDFs to make it more easily distributable or digestible. That's why we've added clinical interpretations. That's why we're constantly working on how we can search or improve our search, and trying to make it more relevant by thinking about high priority and high profile reviews, make those more readily accessible.
That's great, Chris. And something else I kind of picked up on actually was, as we've said, Cochrane Clinical Answers are based off of the Cochrane reviews. But when we're working with a clinician who is like a subject area expert, like they're really close to that, they may turn around and say, we really need this outcome in here. And as a CCA, we can report that and say it wasn't assessed. But there is a feedback system built into Cochrane reviews. And so if that kind of thing is raised, our internal team can share that as feedback. The review authors may consider that when they're updating it. So it's a really nice kind of cycle that we actually have there, where you may find that Cochrane Clinical Answers could help inform the updates of the review. So yeah, it works nicely together.
Yeah, and this may not surprise anyone who's ever worked with an editor, but as a bunch of editors, we are constantly providing feedback to our Cochrane review colleagues about things we find in the reviews to try to make their product better as well.
Yes, it's a nice relationship. Um, there aren't any other questions in the chat so far, so I'm sorry, guys. I'm going to kind of like steal the time and ask another one. So the CCA that Chris shared the example of earlier, 13 outcomes in it. Chris, you mentioned kind of about we aim for the most patient important comparisons and outcomes. I was wondering if you could maybe share a bit about kind of how we find those, how we decide on the number, why that particular one had 13, would you consider that high, low?
Sure. Thanks, Kat. So I highlighted a couple important distinctions between disease-oriented evidence and the idea of patient-oriented evidence. Um, you can say outcomes the same ways you could say evidence. And each time that we are extracting data from a Cochrane review and we're trying to put it or readying it to be utilized in the format for our CCA writing, which is meaning shared with our associate editors who are practicing clinicians, shared with their clinical advisors. We have listed the outcomes that have been considered overall from that review. And we're then asking the practicing clinicians to look at said outcomes and initially make a decision to say, hey, is this appropriate? Because this is actually something that's patient oriented or not. The other thing that is then done is, of course, when I'm doing my final sign off, I'm also looking at things. And if there was an outcome that was somehow included and made it through to the step where I'm seeing it, and it was really not patient oriented enough, I'm usually cutting that outcome. And the reason is because we're trying to really think about the practicing clinician who's taking care of the patient or the population that's in front of that clinician. And so it's a engaged process. And what that usually means is that we're beginning to whittle down or cut down on some of the number of outcomes. With this, because we had both maternal and neonatal, so with this specific PICO, with this specific CCA example that I utilized, because we had both maternal and neonatal outcomes, we always are going to have more outcomes that are utilized in our CCA. If we're usually working with just one group or one patient population, that obviously is going to decrease the numbers, decrease the number of outcomes. I don't know if I probably could look this up and figure out what the average number of outcomes were, but I would say it's somewhere in the neighborhood of 5 to 10. And so certainly with the 13, that was high.
That's great, Chris. Thank you. And that's a great point about when you've got kind of a CCA like that and the population is actually split, that we've included maternal outcomes. We've included outcomes that relate to the infant, the child, that maybe that kind of like the number has to increase because those outcomes are still really relevant. We don't want to just cut them off because we want to keep it short, even though obviously being concise, being focused is one of our CCAs. And that's great.
And again, that's still our job to, and sorry to cut you off, Kat. I just was going to say that's still our job to try to make the answer concise, even if there are lots of outcomes that we're considering for that answer.
Yeah, no, that's great. Thank you. And if anyone here today is thinking that this sounds up their street and they would like to help kind of shape CCAs, as Chris has said, get in touch with us, please. That would be fantastic.